2 billion people worldwide rely on solid biomass, wood, charcoal, and crop waste for their daily cooking. The public health cost of this reliance is severe. Household air pollution is linked to chronic respiratory disease and cardiovascular failure, contributing to 3.7 million premature deaths every year. The standard, widely funded intervention to mitigate this crisis is liquefied petroleum gas, or LPG. It burns efficiently and is highly portable, making it the default technological upgrade for rural communities. To quantify the exact health benefits of this transition, major institutions, including the U.S. National Institutes of Health and the Gates Foundation, funded the Household Air Pollution Intervention Network, or HAPN trial. Global health professionals universally prescribe these cleaner fuels under the assumption that reducing smoke immediately saves lives. The trial hypothesized that providing pregnant women and young infants with free, continuous LPG stoves would result in measurable improvements to maternal and infant health. Environmentally, the intervention was a clear success. Stoves burning LPG generate a fraction of particulate matter of an open wood fire. This line represents the expected linear relationship. As fine particulate matter drops, human health is supposed to improve accordingly. The actual results from the HAPN trial sever that connection entirely. The trial established that the biological requirement for clean air is more stringent than previous estimates, requiring a reevaluation of global transition strategies. The HAPN trial tracked 3,200 households across Guatemala, India, Peru, and Rwanda over 18 months, maintaining strict monitoring of pregnant women and their infants. This bar chart shows baseline environmental exposure. The control group averaged 100 micrograms of fine particulates per cubic meter. The LPG group saw a 66% drop, averaging 35 micrograms. That aligns with the WHO's Target 1. 69% of these households fell below this threshold. Meeting this target is a critical metric. WHO guidelines dictate the flow of billions of dollars in global public health policy. The trial successfully proved that providing LPG hardware effectively lowers indoor exposure within the home. The primary clinical outcomes published in the New England Journal of Medicine contradicted the environmental findings. These graphs track key health indicators: severe infant pneumonia, stunting, and birth weight. Here are the plotted results for the control group, and here is the intervention group, breathing air 66% cleaner. Notice how the confidence intervals for both groups overlap perfectly. In clinical terms, these overlapping intervals indicate that there was no statistical difference between breathing heavy smoke and breathing LPG emissions. Despite breathing air that met WHO targets, the infants and mothers experienced no measurable health benefits, challenging the foundational assumptions of global health models. Why did a 66% drop in pollution fail to trigger biological healing? Researchers have isolated 3 physiological bottlenecks. The first is biological timing. Reversing cellular damage and ensuring healthy fetal development likely requires intervention well before a pregnancy begins. The second is the residual emissions gap. A fuel that burns cleaner is not a zero-emission fuel. This kitchen cross-section shows how LPG still emits fine particulates and nitrogen dioxide. In poorly ventilated spaces, hitting the 35 microgram target leaves enough toxins to stall recovery. However, studies show that adding a mechanical range hood reduces these residual particulates by over 80%. The third bottleneck is competing determinants. An isolated clean cooking intervention cannot override compounding factors like malnutrition or heavy outdoor ambient air pollution. The engineering takeaway is clear. Transitioning a household to LPG is physically insufficient to protect health unless it is paired with robust mechanical ventilation. The alternative is to move past the combustion process entirely by adopting electric cooking. To achieve actual health benefits, interventions must treat household air pollution as an absolute eradication target, not just a reduction metric. The sector is now shifting its objective. Because incremental reduction is insufficient, interventions must target zero household emissions. This creates massive economic friction. A basic improved biomass stove costs roughly $15 to $30. A zero-emission electric system can exceed $100. Subsidizing this hardware for 2 billion people requires an estimated $8 billion in global investment every year. To close this gap, the clean cooking sector is turning toward voluntary carbon markets. Under this mechanism, corporations purchase carbon credits to offset their own emissions. That capital then subsidizes the cost of clean tech for low-income households. But the system relies on verification. If households engage in fuel stacking, using the new stove occasionally while still relying on wood fires, the credits lose their integrity. Without a mechanism to rigorously prove households are actually using the zero-emission tech every single day, the carbon finance pipeline cannot be sustained. The solution involves replacing manual reporting with digital transparency using the Internet of Things. Embedding IoT sensors provides unalterable usage data, preventing reporting errors. This creates what is known as the clean cooking stack, beginning with the hardware and the sensor. The sensor transmits precise usage metrics to a central cloud architecture. This data directly enables the pay-as-you-go or pay-go commercial model. One data stream feeds a smartphone application, allowing users to pay for the hardware in flexible micro-installments. The second data stream automatically verifies usage to generate a carbon credit certificate, providing the necessary macro financing. The Happen trial results invalidated the industry's long-standing reliance on simple emission reduction as a proxy for health. By aligning zero-emission hardware, IoT data, and carbon finance, the industry finally has the architecture necessary to permanently eradicate household air pollution.